Welcome to our webcast, Improving Health Equity Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Dr. Beverly Crawford, who will discuss the Antiracism Module funded by a generous grant from the Josiah Macy Jr. Foundation. Beverly wrote the section of the module titled Advancing Racial Equity. At the University of Pennsylvania School of Dental Medicine, Beverly serves as a professor in the Department of Preventive and Restorative Sciences. In addition, she is a practicing general dentist in the school's Penn Dental faculty practice. Beverly is the co-creator of the Penn Experience, Racism, Reconciliation, and Engagement course that was offered in over 5 Penn schools for graduate and professional students. Welcome, Beverly.
Thank you. I'm glad to be here. Thank you for the invitation.
Oh, I'm so happy to have you and to talk about the anti-racism module. So how did you get involved with the anti-racism module?
So, as you mentioned, I'm a professor at the University of Pennsylvania School of Dental Medicine, and we are in a space called University City. And so I teach and practice in that area, sharing space with many universities and healthcare centers. So we tend to see a movement of faculty and staff across the different systems. And one of our uh, previous staff members started working at Drexel University, and part of the Macy's grant is housed there. And apparently what I was doing at Penn Dental Medicine resonated with her. And I think she recommended me to the group that was working at Drexel. And, the Macy Grant group, they reached out and I was happy to join them because they were working on exactly what I was working on at the same time at the dental school. So that's how I was able to join the Macy's Grant team.
Oh, that's great. And there were about 65 people on that team. And not all of them, of course, wrote. That we had different sections. One was faculty development, one was assessment, and the other one was curriculum guides. But you were in the content, the module content area. So why did you decide to write the section on advancing racial equity? And maybe I can just step back for a moment and say that the content group, which had probably, I'm going to say 8 people, 8 or 10 people involved, spent a couple of months deciding on what the topic should be. I mean, this is a huge area, anti-racism, but what are those topics? What's missing in curricula? In schools, what do students need or learners need? And so there were 18 topics that were selected, and one of them was advancing racial equity. And then we asked who would like to write the various sections, and you volunteered for that particular one. Why was that, Beverly?
So in advancing racial equity, I wanted to look at equity in terms of healthcare. I wanted to look at health equity. The idea that everyone has a fair and just opportunity to be as healthy as possible. And in the news at the time, there were articles about NFL players who had suffered concussions and were being evaluated on outdated race-based medical protocols. And I wondered if such beliefs existed in the dental profession. I know the opioid crisis was in the national news. Some of the causes written were about young adults who had had their third molars extractions and had access to opioids for postoperative pain. And for me, this was interesting because I was also aware that patients of color were not receiving enough pain medication based on unconscious bias that suggested that they were more likely to abuse medication. And we also had the Affordable Care Act that had recently included dental treatment as part of its Medicaid expansion, but only 1/4 of all the dentists, 1/3 actually, 1/3 of all the dentists in the US, currently treat at least one Medicaid patient. And finally, the other reason was that there was a student who was currently writing about Racism in Dentistry. And she had asked me to take a look at her paper. And the paper followed the history of racism in dentistry, starting with the graduation of the first Black dentist to the incorporation of the dental care coverage in Medicaid, and then covered the death of Diamante Driver because his mother could not find a dentist to extract an infected tooth. So I was fascinated to see, to look at the area of health equity, equity in healthcare. Um, so that's what brought me to that particular section of the paper.
And how did you actually go about researching that? So I guess you had a student who had done some research already, but you were looking at the history and how it's evolved and what are the biases in dental education as well as other education, medical education as well. How did you research this section?
Well, I started looking at oral health disparities and the lack of access to care. And from there, I looked at the social determinants of health. And in the dental realm, there has every 10 years or so, there's the Healthy People. We started with Healthy People 2010, Healthy People 2020, and we were currently looking at the objections for the objectives of Healthy People 2030. And looking at that, and also as because I'm also in education and I teach our students at the dental school, I also looked at training the future dental workforce in understanding the impacts of the social determinants of health and how we can begin to prepare this new generation of oral health professionals, to make them uh, able to identify and address health disparities and to think about not only oral health equity, but overall health equity.
Mhm, mhm. So what's included in this particular section, advancing racial equity in the anti-racism module?
So under the overarching title of Advancing Racial Equity, in that module, there are three sections. Now, I wrote one section, the section on racial equity, and as I said before, looking at it in terms of health equity, in which I discussed the social determinants of health, health and healthcare disparities, and racism as a determinant of health. But there were also two other sections that were written by two of my other colleagues from healthcare systems within the Philadelphia area. And those two sections were the first one was on research, policies and procedures and practices. And then the third one was on the anti-racist approach to clinical care.
And we're hoping to actually have them on this webcast as well and interview those authors. What surprised you about your research?
Um, Not so much surprised, but reinforced the oral health disparities and reinforced how oral health disparities contribute to overall health disparities.
Mhm.
Um, Dental health providers, when we train them interprofessionally, then they can address the factors, of systemic health, and they can also recognize at-risk patients as well as working to improve oral health. A patient that comes into our practice, when they come in, we check their blood pressure. We take a very complex medical history. And sometimes the blood pressure and just the simple oral exam can help us determine or ask, possible systemic health concerns. Hypertension, patients, we can refer patients to their primary care physician, patients who may not have, who came in because the tooth hurt, you know. So we, so what surprised me and what that didn't, as I said before, that didn't surprise me, but it did reinforce the connection between oral health and systemic health and how important it was for our students to be trained interprofessionally to understand complex medical situations and be able to refer accordingly.
So is the dental practice that you have, is that within the school and that people from outside the school can go to have their teeth checked or things done? Or is
So
it
my,
totally separate?
yes, so our school sees a lot of the community residents, and they're seen by students, they're seen by residents. I'm in the faculty practice, and I see most of many of the employees of the University of Pennsylvania. But the the students, the way our students work with the patients and the way we work is with our patients is similar. Our students are actually trained in seeing patients who have disabilities, um, physical as well as mental concerns. They are trained to see these patients, and we actually have a comprehensive care unit that our students practice in, and where we were able to see patients with not only physical but also um, mental concerns. And when I say mental, I mean, concerns. Mental is not the correct word. Um, Concerns that are not physical. And in our faculty practice, we receive similar training, so we are able to see patients, older adults that may have been diagnosed with autism and spectrum disorders. So, but most of the patients who are from the community, they are seen in our student clinics, and our students are being trained by faculty who are also aware of the complexities that some of our patients have.
Mm. That's great practice for them, I'm
Yes.
sure. Yes. Why do you think that the anti-racism module is important, Beverly?
So if I can go back to the reason I got involved in the anti-racism module is talking about health health equity is because it's important because scientists have known for years that race has no genetic component. That is a social construct. Yet, in some healthcare curriculums, they're still taught examples of what we now describe as race norming. When medical test results or medical risk assessments are adjusted based on a patient's race. In the module, we talk about disparities and inequities, disparate wealth, education, and social status. We have built environments with exposure to toxic air and water. We have this diminished healthcare access, resulting in adverse processes. We have lack of safe community spaces resulting from decreased healthy activities. And in these environments, many of our communities of color reside. So I thought it was important that as part of the anti-racism module that we look at all these complex community concerns under the broader title of health inequity and health disparities.
Mhm. Is there any other information that you'd like to add as we wrap up here?
I just wanted to conclude with a very short sentence, which is the purposeful consideration of equity in healthcare. I think we just have to be very purposeful on when we are in healthcare, when we're treating patients, when we're looking at research and diseases that we encounter and treat, that we consider equity um, in treatment of patients.
Yes, absolutely. Thank you so much, Beverly.
My pleasure. It was great to revisit the work what we did, 2 years ago, and remember the community of academics who collaborated on this very important body of work.
Thank you. You've been listening to Beverly Crawford talking about the Antiracism Module section that she wrote on advancing racial equity on our webcast, Improving Health Equity, Resources and Solutions. I'm Barbara Lewis. Thank you for listening.